thanks everybody for joining us today, and welcome to the NDSU Extension Horse Webinar Series. Today's webinar, we're going to focus a little bit on the current topics. So we're going to focus on the recent equine herpes virus outbreak and the key biosecurity practices that we as horse owners should know about. So we're pleased to have our North Dakota State Veterinarian, Dr. Equine Andress, with us today. He's going to provide a current update on the situation and share some guidance for horse owners. So again, we're glad that you could join us. I want to encourage you to put any questions that come to mind today into the question and answer box at the bottom of your screen. Feel free to use that chat too if you want to share where you're joining from, or throw some questions in there as well. We will address those questions at the end of the discussion with Dr. Andress. So we're glad that you're here, and we're going to go ahead and get started.
Thanks for having us here today. I'm Ethan Andress. I'm the state veterinarian, and we have Dr. Beth Carlson, the deputy state veterinarian, is also on the call, so she can correct any of the mistakes that I make. As you've all been seeing over the last couple weeks, we've been seeing a lot of activity on the equine side and a lot of cancellations of events, and so this is going to be a topic for at least the next couple weeks, and we'll move forward with kind of a summary of where this started and what's going on. So all of this originally started at an event in the first part of November 6th through the 9th actually was the final day, and it was the Women's Professional Rodeo Association World Finals and Elite Barrel Racing event that was in Waco, Texas. And there were somewhere over 1,000 horses at the event. And there's lots of discussion at this point on whether there was actually sick horses there or if that is just where the first exposure took place. But within the next week, up on 11/17 to 11/19, they had the Barrel Futurities of America World Championships in Guthrie, Oklahoma. And as that was getting going, they started seeing a couple of the horses at that event, and some other places in the country that had been at the Waco event started to break with disease. And so that they had to make some very quick decisions on whether to cancel the current event as it was, and they decided to do so. And then they started sending people home because they didn't really have facilities there to quarantine all of the horses that were on the facilities. So we noticed, my really first notification was about 11/18, November 18th, and that was, we started getting stuff on social media. Started seeing stuff, friends posting of what was going on. And so we didn't actually have an update on anything until the following day. We had a meeting then with Texas and Oklahoma to discuss the situation as it was going on. And at that point, it was kind of a large unknown. By then, a lot of the media hype and the social media hype especially had taken place. And so there's a lot of people that were really scared, that had not only participated in those events, but also other people that were concerned that it was going to come to an area near them. At this point, as of yesterday, there was 47 cases located in 8 different states. Predominantly, they were in those cases are in Texas and Oklahoma, 23 in Texas, 10 in Oklahoma. And then there's also cases in Louisiana, New Mexico, and Arizona, each of which had 3. And then we had Washington with 2, Colorado with 1, South Dakota with 1, and then an additional one that I didn't see. It wasn't updated on the website yet when I put this together yesterday. 9 of the horses at this point were positive without, the neurological signs that are characteristic of this disease when we see it, cause the fatalities. And there was 34. That first group, the 9, had fever and respiratory signs and did not have the neurologic signs. And then there was 34 up to this point with neurologic signs. We don't have information on how many of those horses have died, but hopefully we'll get more information as we move on. Unfortunately, there's not a follow-up piece to that. And then there's 4 horses that were positive that had been tested but were not showing clinical signs. So for our event, for our activities in North Dakota, as those events in Texas and Oklahoma started reaching out and letting everyone know what was going on, we were notified by Texas that we had horses that had been involved, and our system actually worked there. All the horses that in that initial go round had health certificates from the state, and we were actually in contact with them almost immediately as we received word. The Oklahoma event sent us information about the same time, but a lot of that information was not accurate, and a lot of the traceability of our ability to find the owners of those horses was challenging. But in the end, we were able to get everyone contacted, and we had 5 owners with 10 horses in attendance of the Oklahoma event. And of those, 1 horse owner had returned with 2 horses. And then in the after portion, there were some horses that were at a training facility, not on the original location, that had 3 horses that came back additionally. At the Texas event, there were 5 owners with 14 horses in attendance, and 2 of those owners had returned with 5 horses. This virus at that point, we wanted those owners to get someplace where they could be comfortable, that they'd be safe. What we'll go through additionally with the disease, I'll go back to the previous slide, and I'll see if we can share a video. I'll give a little summary of the disease itself from a presentation that was given by the American Association of Equine Practitioners last week. So we do have some horses in the state at this time. None of them are sick that we're aware of. They're temping twice a day. They are quarantined. And so, I don't have any significant concerns with things that are going on in the state at this time. So I'm going to go back here and see if we can share this YouTube video.
Equine herpes virus. So
Yep.
there's many different equine herpes viruses. We're going to focus on EHV1 today, but the clinically relevant viruses, herpes viruses, are 1, 2, 3, 4, and 5, and they cause lots of different disease manifestations. EHV1 and EHV4, most common of those viruses, and they generally just cause fever and respiratory disease, though they may also cause abortion or neurologic disease. Of EHV1 and EHV4, EHV1 is much more likely to cause neurologic disease than EHV4. It's really quite rare for EHV4 to cause any neurologic signs at all. Talking about transmission, so the virus is shed most efficiently from nose-to-nose contact, though it can be shed just by aerosolized virus particles. And that means that all horses that are relatively close to each other in a shared airspace can shed the virus. One that's shedding the virus, a horse nearby, can contract it. And so that's something to think about when Dr. Flynn is going to talk to us about biosecurity and how to isolate and quarantine these horses. It's an aerosolized virus that can be shed in airspace with each other. And then notably, the virus can also be transmitted by fomites. So not direct horse-to-horse contact, but by their human caretakers, by our clothing or boots, by hoses or water buckets quite efficiently, actually, and then any tack or shared equipment and the stall and the environment that these horses are staying in. Environmental contamination is a really important thing to consider. While the virus is exposed to light and air, it doesn't last very long in the environment, but in wet or shady areas, it can persist for up to 21 days. And so that's something to consider, again, when you're considering biosecurity in your home barn. Okay, a little bit about the disease mechanics or the pathogenesis of this virus. So this virus is shed and transmitted by nose-to-nose contact, and the respiratory tract is the primary site of infection. The virus goes there first and then infects the local lymph nodes of the head and neck. The virus is then, within the local lymph nodes, carried in the white blood cells, and particularly the monocytes, which are a type of white blood cell, carried throughout the body. And then The white blood cells are in the bloodstream, and viremia is the word for that. So viremia is virus in the bloodstream. So the incubation period for equine herpes virus, or the amount of time from disease exposure to clinical signs, is generally about 2 to 10 days. However, that initial fever or lethargy that horses might get from viral exposure, it can go unnoticed, right? These are herd animals. We don't spend every moment of the day with them. And if they're stoic, then we might not notice them being a little bit off. And so that initial fever or not feeling well, it might go unnoticed. The onset of neurologic signs may be longer than 10 days. So maybe they had some low-grade fever, weren't quite right on day 5 to 7, and then you think you're in the clear, you're after day 10, but then the neurologic signs can start afterwards. Talking about EHV1 can cause several different types of disease, and all of the disease manifestations are shown on this slide. In many cases, EHV1 is asymptomatic. So horses are exposed to it, they get the virus, but they have no clinical signs of disease at all. They might get a respiratory form, which I'll go over in the next couple slides, and they might get a neurologic form, or in some cases in pregnant mares, they might have an abortion as a result of the viral infection. So EHV1 is quite a common virus, and many horses are exposed to EHV1 at some point in their life. Once they've had the exposure, many of them, up to 80% actually, can develop a latent infection of the virus in their lymph nodes or actually within their nerve roots in the nerve ganglion. And so the virus can live and hang out there, and then they may asymptomatically start shedding that virus at any time. We wish we knew all the triggers that would cause a horse that's latently infected to start shedding the virus, but what we know is that stress is likely a factor. And things like shipping and transporting horses, having them in a different environment, are all causes of stress. We know that shipping is a known immune suppressant. And so if we wanted to make a model for a horse to see if it would get a disease from being stressed out, we would trailer them. And so that shows you how effectively these horses that are latently affected, asymptomatic, can then go to a show or an event and then start shedding the virus unbeknownst to anyone. As far as the respiratory manifestation, EHV1 is a relatively mellow virus. So in general, these horses will get a fever. Reminder, a fever in a horse is any temperature over 1015. However, if you're temperature checking your horse regularly, you know where your horse lives under normal conditions, right? So you might be able to be clued into, oh, it's usually 99.3, but it's chilly outside and my horse is 100.9. I'm going to check again in a couple of hours and see if he's still okay. But we consider a fever anything over 101.5. They might also have clinical signs of lethargy, and then they often start to get those upper respiratory tract infection signs. So that's a nasal discharge or an intermittent cough. One of the things that we often see is also a swelling of the distal limbs or a stocking up, and I'll explain why that happens in a couple slides here. So EHV1 is generally, the respiratory form doesn't make horses incredibly ill, and most of them shake it off without any issues or any interventions by us. In some cases, these horses can develop a secondary bacterial pneumonia, and they might need treating, particularly if these horses were just transported from one place to another, makes them more likely to get that secondary bacterial pneumonia. Now we'll go ahead and talk about the neurologic manifestation of EHV1, or EHM, which is equine herpes virus myeloencephalopathy. Let's break down that word a little bit real quick. Myeloencephalopathy means the brain or the spinal cord and inflammation there. So EHM occurs when the virus that's in the bloodstream, that viremia, will trigger inflammation of the blood vessels, which is known as vasculitis. It will also trigger the coagulation cascade. And so these horses have inflamed small blood vessels, and then they actually get spontaneous blood clots within the small vessels of the brain and spinal cord. And I've got two images here that are tissue from the brain and spinal cord of a horse that unfortunately did not make it with EHM. The Image, that's the microscopic image. I'm not sure if people can see my arrow, but the microscopic image on the left side of the screen is actually a small blood vessel that is completely thrombosed. It's completely filled with a blood clot. And then you can actually see these purple cells here are white blood cells. And that vessel is completely thrombosed. There's no blood going through it, which means there's no oxygen getting to the brain in that case. And in the image on the right, these are sections of spinal cord. And so they're cut kind of like spinal cord looks a bit like string cheese. If that freaks you out, I'm sorry about that. But when it's cut in half, it looks a bit like string cheese. And here, these darker tan areas are the macroscopic view of what happens when that blood flow is cut off. And so that's areas where all of the tracts have been damaged from lack of blood flow. And then we get clinical signs as a result. Here's an example. So here's, I put some really helpful arrows in. Sorry, I forgot this slide was here. So you can actually see where those blood clots were and the damage to the spinal cord. Okay. So one of the questions that I've been seeing a lot on the EDCC website, as well as some other Facebook pages, are about viral strains and does the strain matter? The answer is we used to think it did, and now that we've learned more from different outbreaks, we know that it doesn't matter as much as we thought it did. So 2 and now 3 different viral genotypes have been identified. We've got one that's D752, which is a neuropathogenic. It was what it used to be called, neuropathogenic. We've got one that was called the wild type, and then a recent discovery of H752. We know now that all of these strains can actually cause neurologic disease. And so truly, the strain does not matter when we think about the likelihood of our horse getting neurologic disease as a result of EHV1. What we do see is that some outbreaks seem to result in more severe disease than others, but we're still gathering data about this particular outbreak. And so, one of the things that we do, in addition to report real life alerts, is gather data so that we can learn from the outbreaks and hopefully prevent things like this in the future. So what are the clinical signs of EHM? What happens when we get those blood clots in the brain or spinal cord? And the hallmark clinical signs of EHM are hind limb weakness and ataxia. And ataxia just means uncertain footfall placement. The horse looks unbalanced and you're not certain where their footfall pattern is going to be next. They'll generally start with just toe dragging. And so one of the first things owners will notice is that they go into the stall and their horse is making little pathways with their feet. They're dragging their toes through the shavings. And that'll be one of the first things that a lot of owners will notice. And then in many cases that progresses to hind limb weakness and actual dog sitting, like the horse is showing on the left. Horses will often develop urine dribbling, and so that means they're unable to produce a full stream of urine. Instead, they just will dribble urine, and they can even have an inability to pass manure. I've got a horse on the right side of the screen that's actually being supported in a sling in this case, but you can tell he would be dog sitting or laying down without that sling supporting him. However, those are the hallmark clinical signs, but the clinical signs of EHM are really variable, and they're based on the location of those small blood clots and where they cause brain or spinal cord damage. Brain damage does happen in these horses. Encephalopathy, that means inflammation of the brain or pathology of the brain. And in these cases, we can see the horse's mentation change, so they might not be completely aware of their surroundings.
And that kind of covers kind of what I wanted everyone to see, is just kind of get an understanding of that disease itself. And, we were on a call yesterday and there was, they say that, horses that are at these events, as many as 3% might actually be shedding virus. And so it's being shed by asymptomatic horses. And so the EHV1, the herpes virus type 1, is actually extremely common. And so, like she noted, we're waiting at this point to try and get more information to understand why this is, occurring like it is. In the history in North Dakota, we've had, since I've been in this position, we've had two different EHV incidents. One was a type 1 and one was a type 4. And in those situations, we had one of those horses was neurologic and it was dragging his toes as described. And that horse did come out of its condition and recover. However, another younger foal that was involved at the location that had been exposed did actually succumb to the disease, and so it developed neurologic signs and did pass. In the other incident, we had it was a EHV type 4, and in that situation, the animal recovered without real incident. So now what I'm going to go through, we'll kind of move ahead on to more of what's taking place at the current time. And so we're in the stages right now where cancellations, isolations, and quarantines are taking place. And so we're coming right now to upon the date where a lot of that first event that occurred in Waco, those horses that were there and potentially exposed are now out their period of isolation, and so they'll be able to start getting involved again in activities. Obviously, there's lots of exposures that we may not know about because there were horses that went from events in Waco and then went to other events across the country where they could have potentially exposed other horses. They went to boarding facilities. They went on to other locations where they may have continued to spread this virus. The good news is that predominantly it ran through in that first wave, and the numbers have slowed down. So we're the rodeo industry, families and horse owners have done a great job of getting their horses isolated, getting them away from others so that we haven't just continued to spread this virus onward. As we move forward, we're going to continue. I think temperature is a very good thing to watch in horses. And so check that temperature, make sure they're not running fevers. Definitely, the key is to make sure that we don't bring sick horses to events. One of the things we've required right now in the short term is that horses that are coming into North Dakota be inspected within 3 days of coming to the state, so that at least we know we're getting a temp check before they come in. The board is allowing that to continue until we go for a period of 2 cycles, which is 42 days, two incubation periods before we'll lift that restriction. And then we canceled at this time the extended equine health certificates. And there is available through veterinarians the ability to have an inspection, and it's a 6-month-long health certificate. It comes with some responsibility to the owners that they're supposed to make sure that they go online with every event and record their attendance and then record their temperature on that at that location, so that we can we have a lot of these horses are literally going state to state to state for activities, and they're professional athletes and will go have an event every weekend. And so trying to keep up with having current health certificates, this extended equine health certificate makes it much easier for these very active horse clients. And like I said, at this time, that'll be suspended until we get back to a more normal status. When we look at equine health, there's a lot of different things that play into it, especially as we see with herpes virus. And so just thinking about equine health, we need to make sure that we have adequate nutrition, making sure that we have the quality feed and water, because anytime you end up with not having adequate nutrition, weight loss, that creates conditions where the body's immune system may be compromised and can lead to increased risk of disease. The environment is important. As I mentioned, we've had those cases in the past before in North Dakota. In those cases, they typically show up in the winter. And it's not too surprising that, with a herpes virus that needs a horse to be immunocompromised, and we have horses that have these latent infections. They're infected with the virus, but it's laying dormant in their nerves. And then when we get under the stress of winter, that can trigger the immune system to require additional needs. The genetics probably play some components, because if you have species that are specific to certain environments, they may be able to handle the weather conditions, the stress of heat or cold. There may be some animals that are less susceptible to certain viruses. Fitness of the animal for the environment is important. If we have horses that have just spent the last 3 months down in Texas and come back to North Dakota, are we planning accordingly to allow them to adapt to the new environment? Because obviously we're going to see significant temperature differences, different humidity, different feed. And so all of those things can play a factor. And then on top of that, we have disease pressures. We know that disease is kind of ever present. It's part of our existence as animals and mammals, is that there's always going to be a certain amount of disease that's present. And then when the right organism is in the right place at the right time, allows for that animal to, with a weakened immune system, to that organism to take advantage of those opportunities. The typically equine infectious disease, we think of a lot of different things. There's the viral, bacterial, fungal, parasitic, and prion diseases is typically what is seen. Most of the ones that we deal with, predominantly, I'm sure there's a lot of parasites that we deal with bots and worms. We see especially in young animals. Viral and bacterial infections can also be very common. We have a lot of other viruses that can affect horses, including some bacterial things like strangles. And so, the good biosecurity is important to kind of control all of those things. And so I just wanted to share some of the terms that we use. And sometimes you'll hear the word endemic. And endemic simply means that the organism is part of the existence and normal for our environment. And so when we talk of equine herpes virus, it's endemic in our equine population in the United States. We know that, as they noted, as many as 80% of the horses may be exposed to this virus, and a large percentage may be carrying latent virus, dormant virus that at the right time can become be shed. And so at that point, we know that disease is ever present, and so we're not going to be able to eliminate it, and it's endemic in our handling of those animals. Then we use the word like foreign animal disease, and that typically is involved with diseases that are not endemic. They're diseases that come in generally from outside. And so we have certain diseases that we worry about coming into an area that typically we think of things that come in from overseas into the United States. And then there's the zoonotic. We're fortunate. There are a limited number of these, but zoonotic means that infection can go from animals to people and people back to animals. And one of the most common ones you probably hear about right now is avian influenza. Is that right now, that is the worry, is that could become zoonotic. Right now it affects predominantly birds and some cats and some seals, but we worry that at some point that could become a problem with humans, in which case it would be considered. And we have had 70 cases of disease. So, avian influenza has the capability and is sometimes zoonotic. As far as disease reporting, there's a list of reportable diseases. There's both a federal list and then a state list, and those can be located online. I think I have that probably on the next slide of where you can look up those diseases. A lot of those diseases are generally ones that affect, tend to have an impact on either human health or have significant livestock impacts. And so you can go through those lists if you would like Responsible parties for reporting diseases is predominantly the owner and the veterinarian. They're expected to, if they run into a strange disease, that's supposed to be reported to our office at the state veterinarian's office. And we do receive all the lab reports that from across the country that would be involved with North Dakota owners. And so a lot of times we already know about it when an owner or a veterinarian contacts us. And so when we see it come across our desk, we are already reaching out to the veterinarian or the owner. And sometimes it will involve Health and Human Services if it involves a zoonotic disease such as rabies or avian influenza or any of those diseases that are of human concern. So these links we can provide, and you can look up very easily, is just looking up reportable diseases for the state of North Dakota. And the expectations is that these diseases will be reported to the state veterinarian's office. Like I said, the lab will take care of the lab. Most of the time, the labs will already have notified us at the same time they notify the veterinarian. Disease prevention, there's the key components to this are really to work with your local veterinarian and talk through what things you should be concerned about, because that comes down here to vaccination. If you're involved in a lot of activities and exposure, there's some diseases that are spread from contact between horses. There's some diseases that are spread by mosquitoes. And so it's important to make sure that you understand that the needs of what your horse's risks are. And so we know that mosquitoes spread West Nile and some of the other encephalopathies. And so talk with your veterinarian about making sure you have a complete vaccination program. Sometimes people will vaccinate for strangles as well, especially if they're getting exposed to a lot of other horses that are of unknown health status. Nutrition is obviously key, because anytime you end up with nutrition issues, that can create immune system issues that may make a horse more susceptible. And probably the key thing that's really been brought to all of our attention right now is that biosecurity. And biosecurity is kind of a popular buzzword, and it's really just using a lot of common sense. And so it's largely about making sure that you try not to bring your animals into a position where they would be exposed to disease, and eliminate the risks of things that could bring those to your animals. When we do deal with disease treatment, there are a lot of big words that get involved. But when you deal with diseases like equine herpes virus, it's a virus, and so we know that there are some limited things we can do. They kind of have to run their course. And so we typically think of supportive care, and that's using IV fluids or other things to address the symptoms. And so we're not actually targeting a virus or a bacteria. We're just trying to keep the animal provide its necessary needs to prevent it from passing and allow its immune system to fight off whatever's going on. And with some of the bacterial infections, or sometimes with viral infections, they can lead to bacterial infections. We can use antibiotics, and so having the appropriate antibiotic will be done typically through the veterinarian that you're working with, and making sure that you have one that addresses the specific threats that may be involved. There are some antivirals. They're of limited use and sometimes cost limitations. But I think we're going to see, I'm not 100% certain, but I think there are some antivirals that they may be able to, utilize on some of these horses. We know that acyclovir can be used in humans to treat herpes virus infections, and it's common for athletes and people that battle herpes virus infections to use acyclovir. And so I would suspect there's a number of veterinarians that are using it on some of these horses, especially as we know that a lot of these horses were high value horses. Any of those that are involved in those high end activities are extremely valuable and have a need to put additional investments into them. And so the other big key that we've learned from this beyond biosecurity is traceability. Traceability is generally what our office looks at, is trying to be able to follow the animals both before and after an event. And so what happened with Oklahoma and Texas is we saw different levels of traceability. During the first part of the investigation, we were able to find the health certificates of those horses that were involved in Texas and right up front. So we were able to get a hold of those owners immediately. But we also had a number of North Dakota owners that had been down in Texas for a long period of time and had not reported a movement to or from North Dakota. And so we didn't find those, or Texas did not find those horses for us until several days later. So the initial wave of horses was very traceable. The second wave of horses that didn't have the records at our fingertips were difficult to locate. And so I think that's one of the secondary parts to what we need to improve on as we move forward, is really to have that paper trail of what horses are at events and what horses are, where they're coming from, so that we can notify individuals if we were to have an incident at an event in North Dakota, that we have the ability to contact those other states and let the people know that they need to be on the lookout for a certain disease or condition. And so traceability boils down to, where is the disease at, where did it come from, and how can we stop it? What's necessary to get there? And we often use the big word epidemiology in veterinary medicine, and that's really studying the spread of disease through populations. And so understanding where something came from and where it's going to go and how we can control it in the process. So as far as North Dakota regulations, our regulations are primarily designed around traceability and biosecurity. So we use certificates of veterinary inspection. You see a link up there that'll go to our website, where you can look at the various species and what the requirements are for bringing those animals in. There's certificates of veterinary inspection that basically every animal that comes into the state of North Dakota from another state is required to have a certificate of veterinary inspection. And that involves a veterinarian looking at the horse, recording specific identification, making sure that any tests that need to be run, and that's down at the bottom, the disease testing. So like for horses, when horses cross state lines, they need to have a Coggins test, which is for equine infectious anemia. And so that becomes an important part of us being able to make sure that those horses that are coming and going from the state are healthy and meet minimum standards. I already talked about the extended equine certificate of veterinary inspection, that 6-month certificate, which allows a little more flexibility for owners that are making lots of movements. And then health certificates or certificates of veterinary inspection can be either paper or electronic. Traditionally, they've been on paper, but we have a lot of electronic health certificates now where the veterinarian completes the paperwork online, and then that information is submitted virtually immediately to the state of destination and back to the state where the horse originated from. And so it allows for very rapid communication and traceability of those animals. The other part that we've added in the short term especially is really temperature monitoring. And as the doctor was noting, is that generally these horses, even if they're not showing a lot of symptoms, they will their fever will spike, their temperature will spike. And so if you're involved in activities, if your horse isn't looking right, a good thing to do is just take a temperature and make sure it's not running a fever. If it's not running a fever, making sure that it's not, showing other signs of disease. And if they are, make sure you don't bring them to events and spread whatever they may have. It's kind of common sense, but sometimes we need to be reminded. The biosecurity basics, I really recommend checking out the Equine Disease Communication Center. That's EDCC, and you can just type in EDCC online and go to their location. They have lots of information, and that's where you can go to find lots of updates. It's actually where we go as state veterinarians right now to get our updates of what's going on in our neighboring states. We do have meetings, on a very routine basis. When we have these events going on, we're meeting online every couple days. But if you want immediate updates, you can go to this website and it'll show you where the most recent breaks are. And there's a location that tells you exactly what states are involved at the current time. It does have a little bit of lag time because the states are responsible for putting that information in. And so it may be a day or two behind for that information to get updated. But lots of different things to look at. But primarily for when we're looking at biosecurity basics, make sure that you're working with your veterinarian to have the right vaccinations, limit visitors. You don't want to try not to have a lot of other horses coming into your property. When they do, make sure that you separate off animals that are of concern. If you have animals that you don't want to be exposed to things, and then making sure that you always bring in those healthy animals. And then I think one of the other common sense things that we often don't think about is when we go to some of these events, there's maybe common locations where we can collect water or share buckets, or our horses end up mingling with each other, wash locations, and making sure that that there's not the opportunity for that nose-to-nose contact, but also that indirect nose-to-nose contact that it can occur at a water tank or through feed. And so we have a lot of really high-end horses that are extremely cautious. And not necessarily the horses, but the owners are extremely cautious when they go to these events. And so I was visiting with one, and they when they show up at their event, they show up as close to the time as they're going to participate as possible. Their horse comes off the trailer to go to the event, goes in, participates, comes off, goes back to the trailer, and they get the horse back off site as quickly as possible. And while that may be a little extreme, when they're competing at that high end level, they cannot afford to have their horse pick up something inadvertently along the way and then be down and not at its highest performance level for the next week or two. Biosecurity of facilities. If you're looking at making how to prevent, especially if you have animals coming going, is making sure that you know what animals are coming in and out. So make sure that horses that are coming into the facilities and the people that are coming in understand what the basic principles are of bringing healthy animals in, considering what birds and wildlife can bring in, and then remembering that some of these viruses can survive in the environment. And so making sure that we take the necessary precautions to remove anything that might be contaminated, do proper disinfection. And there's a video here you can look at. It's a lot of common sense in just saying, make sure that when you're cleaning up, that you clean up all the debris, because we can throw as much disinfectant as we want on the ground. It does a very poor job if we don't make sure that we get, if we don't make sure we don't get that organic matter out of there. It'll inactivate a lot of our disinfectants. And so cleaning and disinfection can never be overemphasized. And then the other part is don't let the bugs out. If you know you're having a problem, a lot of these boarding facilities, and I think right now we're being a little overly cautious, but I think it's better to err on that side at this time. But if you've got sick animals, don't let those horses go out and spread it to other horses, because that creates a situation where this can snowball, as we saw of what happened down south. Back to the common sense thing, think about the processes of how viruses can spread, think about the risks of certain activities and prevention, and then avoid the obvious risk factors, which include sharing a lot of those common areas where the virus would spread, putting animals together when you don't know their health status, and then dirty environments. If the environments are heavily contaminated with organic matter, it creates a wonderful environment for those viruses to survive long term, and we can have parasites and other things that are capable of spreading. And so, just kind of in summary, disease in animals is common, just like it is in people. We're never going to completely eliminate it. We can try to manage it, and prevention requires a lot of attention to detail, being very alert to the surroundings and trying to eliminate those possible sources. We know from our avian influenza experience with our poultry operations that there's a tremendous amount of pressure from the wildlife that can bring that virus around. And when you're involved in a big rodeo activity, there's a lot of different people coming in with a lot of different exposures. And so the things that you can focus on are preventing exposure to those animals, having the proper vaccinations as recommended by your veterinarian to be prepared, and then reducing the stress on your horses, making sure that they have the nutrition and the hydration to make sure that they're at their peak ability to fight off those diseases. That kind of gives us a few minutes for questions at the end here.
There are a few questions that have come in to me, so I'll go ahead and ask those. And for the rest of the participants, feel free to throw them in the chat or message me directly if you'd like me to ask a question for you. So the first one that came in is, where do you typically see barns kind of slip up on biosecurity? What's the most common mistakes that you see?
So I think, so like personal barns, it's a more of what's coming and going. And so if in shared locations where they can exchange. So we know, like this equine herpes virus, if there's a tank in the location, that there's commonality that those horses all share that same water tank, that everything that herpes virus is going to potentially get exposed to the entire bunch. And I suspect there's a certain amount of aerosolization that can occur where it can spread even in neighboring stalls, but that really reduces the incidence if you can keep them separate and avoid that nose-to-nose contact. And so I think the most common thing is not thinking about those fomites, those objects that can move the virus from barn to barn or from animal to animal, whether they're brushes, bridles, bits, all of those little things that we don't think about. And we're like, somebody needs to borrow something because they forgot something at home, and then they go use your bucket and then bring it back and it's not cleaned and disinfected. And so I think just those very simple things are probably the most important.
Okay, there's another question here related to the traceability and the health certificate. So you talked about why they're important for those traceability reasons. There's a question about those extended health certificates and if they're going to be reinstated at a certain point in time.
Those extended equine health certificates, I would hope that they get reinstated. Because it's very difficult for us, for people that are involved in a lot of these activities, to find a veterinarian and to, especially when they're gone for extended periods of time. And so what we've seen is a lot of veterinarians, and it's not acceptable, but a lot of veterinarians and owners will have a horse that's going on a route of events, and they write the health certificate to the last event, and then that health certificate is good for 30 days, and in theory, and they go from event to event, and there's no traceability when that happens. And so we end up with a horse that was at that event that does not show up on our radar, especially private events where there's not a huge process where we can go back. Like these big activities, they have registration process. It's much easier to follow back those animals. But when we end up having these animals going around and we're not recording those locations, it gets very difficult to trace those animals.
Thank you. There's another question here about the consequences, I guess, of not having those. Of course, they're saying their neighbor travels without them often. So what are the consequences for not having a health certificate?
Yeah, if you're if you're traveling across state lines without health certificates, it's largely the states of destination that are responsible for enforcement on those movements. If those animals are coming into North Dakota, our office and the Board of Animal Health is responsible for enforcement. And we've issued in the last year, 2 years, approximately $100,000 in fines. And so when you're moving animals without following proper traceability, the board has the authority to fine up to $5,000 per violation. And so a lot of times they are fining in these situations $2,000 with 1,500 suspended with no violation. For people that are deliberately avoiding health certificates, they may go all the way up to that $5,000 as a fine. The one thing I would mention, I've had before we run out of time, is I have had a couple calls asking what to do about some of these local events, or people have a local facility that they have that they get together and have ropings and have some fun. And I think we have to use a little common sense in this situation as well. As we understand, this virus is not going to go away; it's going to be present as we move forward in the future. But we still have to go on with life. And most of the horses that are located in the state of North Dakota, almost all of them, have no more risk today than they did the other day. There's only those horses that were at those events that had that potential exposure that are at that higher risk. Now, we can't say that we're not going to, as was noted in that video, this virus is common and it can show up anywhere. And so we do need to be aware of it, but I don't know that we need to go about canceling events at this time in the state. I think it's good to recognize who the participants are, to make sure that the participants understand what their risk factors are. Horses that were involved in these southern events where there was virus or are coming from facilities that had infected horses. I would discourage those horses that are not past those isolation periods, from participating in activities. But those local events where there's local horses that haven't been traveling, those events should be able to carry on as usual, just with a lot more common sense than we've probably used in the past.
Thank you, Dr. Andress. That kind of addresses the last question that I had in the chat box here, is about the kind of the panic that set in and how worried people should be here locally in North Dakota. So I think that kind of addressed that, and a lot of the myths and information that floats around on social media. Do you have any comments to that? Where do you recommend people go to decipher between what's fact and not?
Yeah, we had some calls yesterday. There was a rodeo show that was, trying to implicate vaccines as being the cause of some of this problem. And we have to be careful not to, there's a lot of stuff that comes out on social media that is not completely accurate. They take partial facts and then they distort them and make them into something bigger than they are. We know that the herpes virus vaccine is not going to be 100%. We know that it's a modified live, so it can potentially cause some latent infections. But we also know that vaccine is very effective at stopping respiratory disease, which is the primary way in which this virus is spread. And so if we can reduce the shedding of a horse through vaccination, we're going to reduce the exposure to other horses at those events that may pick up that virus and develop the neurologic form. And so work with your veterinarian, try to avoid the gossip. There is a lot of fear mongering that's gone on with this, and a lot of it is a legitimate concern, and we need to take proper precautions, but it's far from the extreme the extreme problem that I've seen portrayed in a lot of social media.
Thank you. I don't see any more questions coming in. I am going to launch the last poll here. If participants could fill that out, we'd appreciate it. And just some final comments. We do have a couple more equine webinars coming up from NDSU Extension this month. Next month, we're going to visit about manure management and properly handling that, and some tips and tricks to get through the winter in North Dakota, dealing with that manure management topic. So Mary Kino will be joining us next week to cover that. And then the following week, we're going to talk about finances and what it takes in 2025 to take care of your horse and to finance a horse adequately. So we're going to talk about some expenses, budgets, that sort of thing. So please feel free to sign up for those. As always, we will send a recap of this meeting to all participants. We'll send the meeting link along with all the resources that were shared here today. So you'll be able to easily click on those and find those. And we do want to thank Dr. Andress for joining us today and sharing all of his information and insight. And thanks to all of our participants as well. And if I don't see any other questions, so with that, we will wrap up the meeting. And once again, thanks to everybody. Have a good day.